No, I'm just so proud to be with all of you for this groundbreaking launch of the foundation. It's really an honor. What I'd like to do today, because I want to hear more from you than from me or others, but what I'd like to do is I'm going to tip it off first to our Executive Vice President. Many of you know Luke Neferratos, who's really led the charge at SAM for so long and will also be leading the foundation as a co-founder of this. When we had these ideas 3 years ago, we looked around and saw that there was really no unifying drug policy national voice, outside of government, that was trying to bring together the best minds in research and practice in both the political, non-political arenas from a nonpartisan perspective. There was nothing out there, which is shocking. There were a lot of groups doing a lot of good work, but really promoting that good work so that people realize that there is hope. I mean, there are things we know that can work if we bring them to scale. It's not completely hopeless. We're living at a time where overdoses are the #1 cause of death for people 18 to 45. We are oftentimes going back to unimaginative, small-minded thinking that is just maybe helping on the margins here and there, as opposed to really a holistic, systems-wide approach to drug policy and really bringing it up to the level and stature that it should. So, Luke, maybe you could chat for a few minutes, and then we'll talk a little bit more about the foundation. And then I would like to open up with the group, really. And I haven't prompted any of you with any of these questions, but we'll start with some questions. But Luke, if you wanted to say something.
Yeah. Hi, everyone. So good to see so many of you friends in person again. Some of you in person for the first time. What a pleasure. Thank you for joining us for what I think is going to be something we'll all look back on as a historic moment where we were given an opportunity to be people to step forward and do something about this crisis, and we all stepped up to the plate. So I applaud all of you for joining us on this journey, this adventure. Last year, 41 million Americans needed treatment, and only 6% got it. And yet, we look across our society. I live in Colorado, the epicenter of the drug policy debate right now, where people are just throwing the handbook out on treatment and prevention, just saying you should just legalize drugs. We're going to be voting on legalizing psychedelics in my state here this November. There's talk of a whole lot more than that. And we are right now in our society at a crossroads where, one hand, people need treatment for addiction. The other hand, it's never been easier to get alcohol in this country. People can deliver it, they can order it, they can do drive-through, pickup, they can get alcohol any which way they want to get it. They can get addictive drugs any which way. All of our legal substances have never been more available. Vaping crisis, we have vaping in our youth, in our schools, in our bathrooms, all kinds of accessibility. It has never been easier to get addicted to drugs than it is right now. And yet, we look in our state capitals, and it's never been easier to find an addiction for profit lobbyist in our state capitals and in DC. We have an industry that's spending tens and hundreds of millions of dollars to promote these products to our youth and to pay the top lobbying firms to go into these capitals. And so we look around and we go into these state capitals. We are in DC on a regular basis. And the folks that are in the ears of our politicians and lawmakers are not the folks around this table, unfortunately. And so we want to bring folks like you, your expertise, what you're doing to the table in DC and in state capitals, and start pushing forward a public health approach to this addiction crisis, to start pushing for solutions, getting people access to treatment. You look at for-profit industry, it's a company's job to make their product so easy to use, to make it so easy to buy. You can almost do it accidentally. That's what Apple became so famous for. You can almost accidentally buy something. It's so easy to buy at Apple. Okay. And we want to make it so easy to do the right thing. If you are in that moment in your addiction, you're ready to get help. We want it to be so easy for you to get help that you can right when you need it. And it should be that way in this country. Instead, it's so easy to get addicted in this country. We've got to change it. So that's what we're gathered here to do. Very, very grateful to all of you for your partnership, your support, and excited about what we're going to be talking about today.
Excellent. Thank you, Luke. I want to give the table over to Patrick Kennedy, who's been the comrade in arms in this journey really with me for really the last 14 years. It started when he was in Congress and I was in the Obama administration, and then kind of unexpectedly by accident started a group that is still going strong and will continue to exist as a separate entity, Smart Approaches to Marijuana, to really raise awareness about the high potency THC that's being sold by addiction for profit companies. And Patrick talked about a profiling courage, has never been afraid to stand up to these interests, and we're really fortunate to have him guiding our efforts here, Patrick.
Well, Lacey and I served together in Congress, and when it came to any other issue, it was labor. They had us covered. Overtime pay, safe working conditions, pensions. If it was the environment, we had the League of Conservation Voters came. They tell us about air, water, land, sea. It didn't matter what committee we were on. They had an agenda for that committee. But mental health and addiction do not have that kind of sophisticated approach. I guarantee, without going too far over my skis, that probably 80% of our colleagues on the housing committee do not know how central housing is to recovery. I guarantee when 90% of our colleagues who sit down in the committee on education think about what they're supposed to do, they don't realize what they have in their hands in terms of their ability to begin to build social emotional learning, problem solving skills, coping mechanism development, which our kids desperately need today with the anxiety, depression rates that are all facing. You could go to any committee in Congress and find out all the things that could help accelerate the problem or reduce the problem, but we haven't mapped them out. We just have not mapped them out. So I think our job here is to do that and to bring some level of sophistication so that you don't end up on any given committee in Congress at the federal level or state level and not know what you can do. I told a story just over at CGI. I went on the Armed Services Committee because my district in Rhode Island had the largest Navy establishment, the Newport Navy base. And when I got on, I thought, I can't help my friends from organized labor. I can't help my friends from the environment. So they came to my office. And I said, sorry, guys, I'm on armed services. They said, that's great. I said, what do you mean? They said, well, the contractors down at the Newport Navy base are not abiding to Davis-Bacon law. We need your help with the Department of Defense. I said, I couldn't believe I can actually help you on the Armed Services Committee. And then the environmentalists came in. I said, what are you guys here to do? This is the Armed Services Committee. They said, you don't know, Congressman, but the biggest environmental protection budget in the federal budget is in the Department of Defense. It's twice the size of the EPA because all of the big Superfund sites in the country are all military bases. And I'm like, wow, I didn't know I could be an environmentalist and be on the Armed Services Committee. My point to all of you is that we need to map this out because everyone thinks this is just a single solution here, a single solution there, as opposed to us putting together a much broader set of solutions that could be adopted on a more comprehensive basis. And so I want to thank you, Kevin, for your leadership. You've really been the inspiration behind all of this. And Luke, you're so clear that we've got the right people helping to make this happen for us. And Mitch, you started Phoenix House and I wasn't even born yet. So I don't want to make you feel like
One of the things I wanted to talk about too is just announce some partnerships. So the foundation will be working very closely with the Rosenthal Center for Addiction Studies as a division in terms of furthering our research and under Mitch's leadership. And we're honored to be working closely with Mitch. We've also begun to work with the National Alliance for Model State Drug Laws, which is really a commission that started as a presidential commission over 20 years ago to try and have uniform and laws across our states when it came to best practices. Because if we know a best practice and we have one and it's implemented in 3 states, well, there's 47 more states that need to learn from it. And Michelle Worobiak has led that effort for many years now. Maybe Michelle, you can just speak for a few minutes on the critical work of NAMSTIL and our new partnership.
Thanks, Kevin. And I'll say that when you gave us the call almost a year ago, it was such an easy yes. The board and Pat Clay is our board chair, so we are excited to have her here. We were excited to hear about the work that you've been doing. And you're right, we've been doing this work since 1993. There was a President's Commission that decided that the way to end the war against drugs is to equip the states with what they needed because they were going to be doing that work. And so within a year's time, the commission created 44 model state drug laws, many of which need to be updated. They're very relevant and the work is still needed. We need to modernize those. And we continue to do this work now. We do it more broadly. So we're working with INL and UNODC on policy and best practices and operationalizing those best practices so that we see them making the impact. Real quickly, Luke, to your comment, one of the model laws that we did more recently has to do with predatory practices, predatory treatment practices. So it's not treatment, but there are business people that know how to get treatment money and rob families, not offer any treatment at all. And we had a model law and the state of California wanted to pick it up. And as you can imagine, I attended some state level meetings and there was pushback. And the way that this law passed was it was created by a group with no personal interest. NAMSTL is not a business. NAMSTL has no personal interest in the outcome of that legislation at all. And we are advised by all the people that needed to have a seat at that table to craft the law. And there was an answer to every single concern that was very well grounded in expertise. So Kevin, thank you for allowing us to spread our wings a little wider and to do this work with these experts. And we're excited to be here.
Thank you, Michelle. And one of the groups that actually got that over the finish line was Pete Nielsen, Christopher Padilla. We're lucky enough to have here in person from the California Consortium of Addiction Professionals to end those predatory practices in the state of California. So thank you, Pete, for your work. It's really helped. We're also very excited to announce our partnership with Teresa Haley, who's the president of the NAACP Illinois. We worked with Teresa on equity issues for really the last 4 or 5 years in Illinois, in the land of Lincoln, regarding marijuana legalization and all the money that was supposed to pour in from commercializing and supposed to help communities of color and disenfranchised communities who you can guess have not seen a penny of that money and are instead being exploited. And so Teresa has been a wonderful partner with us. We're really excited to have her on the foundation as a senior advisor. And I thought, Teresa, if you don't mind sharing a few just words on your experience and the importance of equity and justice and drug policy, I think we really appreciate it.
Thank you, Kevin, and thank you for allowing me to be here. I tell people all the time, it's important for us not only to be at the table, but to be part of selecting the menu. When you're talking about Black and brown communities, you need to have people who look like me at the table. Yes, you are researchers and you do wonderful work and we're grateful and we're appreciated, but you don't know our struggle. You haven't walked a mile in our shoe. So I am so grateful to be here today. When I think about good drug policies, yes, it's needed. It's definitely needed throughout this nation. It's needed in all communities of color. Drugs impact all of us. This THC that's going on today with marijuana, it is not your grandma or grandpa's marijuana. I have family members say, oh, I smoked weed in the 60s and the 70s. It's not going to hurt these young people. I have a 17-year-old granddaughter who's a senior in high school. I was in Sierra Leone in May. She tried to commit suicide by hanging herself. She did not succeed, and she doesn't go to counseling. Her dad drops her off at the front door. She finds her way out the side door because some people are telling her that marijuana is not going to hurt you. It's a way of helping you. Marijuana is killing people. In the state of Illinois, myself and other branch presidents throughout the state, we said, no, this legislation is not good. It's going to continue to hurt us. But people lied to us. Even people who look like me lied to us and said, we're going to allow you to get your own dispensaries. We're going to get back to the Black and brown communities. Guess what? In Illinois, we still don't have our own dispensary. Marijuana is taking our lives. So my goal for being here today is to educate, to empower, and to inform all communities to say that this is not good. So like getting into good trouble, we want to have good drug policy. Thank you.
Thank you, Teresa. I'm going to just talk a little bit about the mission and vision. What would you'd like to look like at the Okay, so what obviously we know this, but I think it's an important reminder, and it's an incredible reminder that We know substance use and addiction in this country, they're a leading cause of preventable death. There we go. They represent America's largest preventable and most costly public health and medical problems. They cause and contribute to more than 70 other conditions requiring medical care, and they drive consequences, including crime, lost productivity, child neglect, and abuse, family dysfunction, and developmental disabilities. The incredible thing about this is that we have, such a gargantuan issue in our country that, although it makes headlines now and again, as Patrick says, doesn't even have an interest group that's organized. And on top of it, really, we have very few full-time organizations dedicated to, spreading what actually works and scaling up best practices. Something that Michelle said about not having really skin in the game in terms of pushing something. A lot of our well-intentioned groups, even in the field, there's an incentive for them to push one particular policy or another, which might be a great policy, and that's good. But it sometimes disallows us to look at other things that could be helpful, because that's not what the organization is set up to do. And so the foundation, we're not going to come in with sort of something in our interest that we're trying to push other than good solutions. And we're lucky with the funding we have from individuals who unfortunately have been devastated by the impact of addiction, who are giving us that really free reign to do that. And to, by the way, not take a penny from for-profit healthcare or insurance or opioid companies in doing so. And we'll be the first national organization to make that pledge not to take a penny from those organizations from that perspective. So we felt that we needed a new national drug policy organizations, and that's why we created the Foundation for Drug Policy Solutions. When we talk about drugs, I mean, we're not ignoring our legal drugs, which, our brain does not make the distinction between legal and illegal. That's a man-made distinction. And so we are absolutely talking about alcohol, which is, still kills almost 100,000 people a year. It's the #1 reason why people are arrested and incarcerated. That's why it's incredible to me when I'm in, Washington at some think tank debating drug policy and what solutions make sense, that alcohol is completely glossed over, despite the fact that there are more arrests for alcohol possession, meaning for minors, selling to minors, public intoxication, and DWI. There are more arrests for alcohol than all drugs combined, including marijuana, including fentanyl, opioids. And yet we ignore it because we have made that distinction because it's become so normalized. We are going to tackle alcohol. We know we're not trying to prohibit alcohol, but there has to be some better regulations around a substance that has not had an increase in federal excise tax, folks, since before the Korean War, when you adjust for inflation. And that's because there are thousands of lobbyists right now in Washington and state capitals. We're going to talk about nicotine. We're going to talk about something that still kills 425,000 Americans every single year, despite the fact that every living and breathing American knows that nicotine, tobacco cause cancer and cause premature death. So we are going to tackle them. We are obviously the illicit drugs. So it really is promoting a science-based solution, because I think sometimes people, we get hopeless and we think there's nothing we can do, that the best we can do is try and keep someone alive and then hope for the best after that. And to me, while of course we need solutions, absolutely we need naloxone. Everyone should be carrying naloxone and know how to use it to reverse an overdose. But that can't be the extent of our national strategy on drugs, because there's a whole lot that happens to somebody before they need naloxone, and there will be a whole lot that happened to them after you administer naloxone. The average person who's administered naloxone, by the way, has administered it more than a dozen times in their life, has no aftercare, and a very large minority of that population will still end up dying. So we're messing up somewhere before and after we're doing that. And when all we're hearing is about, how to put a Band-Aid on the problem, we realize that we have to do more. And I'm going to steal a quote from Patrick, which he used the other day, which I love. This, saying, meet them where they're at. And of course, we should meet people where they're at. We hear that a lot, but we cannot leave them where they're at. And unfortunately, I feel like often that is what we're doing for people with a disease that hijacks the brain, that hijacks reasoning. The idea that we're going to leave them there doesn't make sense. So we're trying to create a vision that is a culture of prevention and a climate of recovery. I'm not going to read everything, but that is what the kind of vision, the kind of world that we'd like to see. And our mission to scale up drug policy solutions by educating decision makers and the public about ways to harness science and prevent drug use, treat addiction, and forge pathways to recovery. So, I'm not going to go through all of this, but we know what's part of it. We are not also ignoring the supply side of it. We cannot ignore the role of our international partners. When we're talking about fentanyl and the analogs that are out there, when we're talking about what's happening globally in China and India and this manufacturing countries, we realize that this is a problem of global scale. We're also not going to ignore the criminal justice system, because while absolutely we need to treat this like a health issue, like the disease of addiction, by constantly using sort of these bumper sticker, treatment over incarceration and creating these false dichotomies, we are actually ignoring a huge extent of the problem. 70% of people in prison today who are not in prison for a drug charge, so non-drug charges, 70% have an addiction. So we cannot ignore the criminal justice system by wishing it away and just saying it's only a health issue, when we actually have to address it in the criminal justice system. And if we can't address it in the system where we're supposedly have full supervision, then we're in big, big trouble. And so there's a lot that can be done, for example, with the Federal Bureau of Prisons. There's a lot that can be done with when we look at alternatives like drug courts, where we need to scale these things up. We can no longer have these boutique programs that we're lucky to have in some community because of some innovative mayor who thought of it. This needs to be a fabric of these systems where we need to build in treatment support, reentry support. So we're going to inform governments and the public about the best policies to reduce substance use, addiction, and its consequences. We're going to educate and expand the understanding of science. We're going to advocate for better laws that promote recovery. And so some people ask, well, what are you actually going to do in the first few years? And so what we're going to do is the next email you all are going to get, and many other people watching this today, we have a lot of people. I want to actually thank people like the Assistant Secretary of Health when I was in the Obama administration, Howard Koh, professor at Harvard, who's I know is on and is serving on our leadership council, and many other people who are on the line right now. We're going to be asking you to come back and help us and gather other experts to create essentially what we have not had in this country, which we should have, which is a blue ribbon commission on drug policy. And we're not going to wait for government to create it. We're going to create it. And luckily, Zoom is pretty cheap. And we also can meet in person too, but we're not going to use funding and bureaucratic loopholes as an excuse not to act. So we're going to be getting really the best minds in the country and in fact the world together, break it down in different categories and look and see what's out there that is working and talk about and have that plan so that we can go to people like Representative Kennedy and Representative Clay and their successors in Congress and say, we have a plan. And here's our 20-page plan or whatever it is with specific policies that we can scale up. That is going to be the work of the foundation. So it's not just going to be debates, discussions, and articles sort of in theory and with 30 people in the room. It's going to be getting experts as well as hearing from people with experience, people in recovery, parents, other community members to get those solutions because we know they are out there. So we're about policy, research, education, and advocacy, governed by a staff and board of directors. And I'm not going to go through the whole group here, but many of you are here. Our leadership council, we're very lucky to have some just wonderful people, former ministers of DEA, former drug czars, judges, researchers around the world, around the country. We're very, very excited. We're very excited to have them. So we'll represent a unifying force in the substance use field, we hope. And many of you know we're working with our divisions, with NAMSDIL, with the Rosenthal Center. And we really, again, hope to, really bring as many people around the table. Anybody who wants to be our partner can be, as long as they agree with our vision. We're trying to bring as many people to the table as possible. There are a lot of policies being thrown out there. We need a lot more research on. We need a lot more discussion on. We need to understand the implications and what they mean. And we need to really work together to get those, because we know that drug problems, they vary by drug. They vary by policy objective. They're not only public health. They're not only law enforcement. They're not usually solved by the free market. Drug problems are complex. They require really a comprehensive approach. that we want to work together on. We are, I think, in a somewhat of not somewhat, we are in a dangerous place in 2022. We're living at a time where we're in the worst drug epidemic in our nation's history. We've had several drug epidemics in the past. None of them reached the scale and scope as our current one. So this is not just a repeating of, the heroin epidemic of the 1970s or of the late 1800s. I mean, this is something totally new because of these new drugs and what's happening. And unfortunately, we have, I think, forces that are trying to really take advantage of this vulnerable time by also pushing dangerous policies. So we're going to be pushing forward with solutions that work and pushing back against solutions that don't work. Unfortunately, down the street from where I live, we are now giving out heroin. We are now giving out fentanyl. We are now giving out methamphetamine. Because people feel like there's nothing else we can do. At the very least, stop the bleeding so that someone doesn't overdose with a bad batch of fentanyl and hope that they only use this, which we have limited supplies of, and we will give you from 9 to 12 every other day. And I hope that works for your addiction. And we are doing things that are clearly not making the problem better, they're making the problem worse. And I think it's not always coming from a cynical place. I don't think the outreach workers that are doing this are necessarily want to see people addicted. It's that they don't know what else they can do. And we really do have to give them hope. And there are a lot of things we can talk about. There are the drug court model that we're going to be really trying to bring up to scale. We're happy to have Aaron Arnold here from NADCP. There are probation programs that have worked in places around the country that people haven't even heard of that have incredible results. And so we need to, again, bring those to scale. And I won't go into professor mode and talk about case studies, but I mean, one great example, okay, maybe I will for a second, is, in the state of Texas, of all places, they wanted to build a prison. It's about $500 million. And then they realized it's very expensive. Maybe we should figure out what else we can do. They ended up essentially investing in reentry programs so that because they knew that 80% of people who left prison were coming back, they were literally building a prison for the people that were already in prison. And they realized that we can do better than that. They worked together and actually did not build that prison because they invested about a fraction of that $500 million in reentry and in housing and in these other areas, by the way, which we often neglect to talk about when we talk about drug policy, whether it's healthcare, housing, hunger, all kinds of other things that are connected to addiction. And by the way, of course, we know addiction touches you whether you're rich or poor. I mean, it's one of the only diseases where the opposite things are risk factors. Having a lot of time and a lot of money and not a lot of supervision as a kid is a risk factor for starting. Poverty and trauma and bad living conditions and a bad education is a risk factor for starting. That's what's unique about this. The other thing unique about this disease, folks, it is the only disease that when you overcome it, you are a better person than before you had overcome it, than before you had the disease. It's incredible about recovery. So we have to be pushing all of our policies, we think, towards recovery. And these are going to be really a multifaceted approach. This is a all of the above approach. These issues are too complex. They're different with different people. And we're really sick of the bumper stickers and we're sick of the either or and the false dichotomies that really get us into the mess that we're in now. And we're in a big mess as a country with this. We cannot keep doing the same things we're doing. And I think some of the things that were offered as solutions are going to make it worse. So again, we thank you for joining us on this journey. And what I wanted to do is to sort of open it up. Mitch, why don't you take it? And then I had some questions for the group. I'll come back there.
Thanks,
and we'll go from there.
That was a great summary.
Thank you.
Well, Kevin touched very much on the criminal justice system. I want to make a point that a lot of you know, some of you may not be thinking about, which is that most people who use drugs are not thinking about stopping. They are comfortable taking drugs, and it is really only when they start to get into court or get into prison that there are possibilities to engage them. And we are, as a nation, not taking advantage of the fact that we have these millions of people in jail who can be engaged while they're there. Treatment in prison is very effective. And if you do it in prison right, you can continue it out of prison. And so we could do tremendous things if we started to see our prisons as a resource for saving lives and for treatment.
Thank you. Great. Well, I wanted to open it up really just kind of more of an informal section now. I have some questions that can guide us, but I wanted to open it up to any reactions that anybody might have to this, any thoughts, any suggestions, comments, criticisms. It's an incredible group around the table. And it would be a shame not to hear from a lot of you. So please, just please chime in with anything you might want to have.
My name is
Yes.
Christina, I'm a CCAP. What you just said, I just appreciate, I worked in the prison system for about 8 years, and I got to see, I was in there doing, doing treatment. I was a program director, I was a liaison between the Department of Corrections and nonprofit at the time that I was working for. So in doing that, I saw people I worked with lifers and long terms, and I saw the effects of not only just serving in their communities to be inside the prisons as a counselor, how effective it was also inside the institutions, but there was some safety legality issues and different stuff with being vulnerable. So there was that piece. However, to plant the seed is very important because that's our future that's coming out, and that wraparound service, somebody said it in here from my reflection, how important it is when it's like a handholding once, reentry. The reentry back into society, especially with our lifer population as well too. So I just wanted to reflect on that, and I totally agree with what you said when you said that, so.
Yeah, if you go into a prison where they're running a good treatment program within the prison, it's very exciting. Bill, please introduce yourself.
Yeah, Bill Stauffer from Pennsylvania. What was being said here resonates with me. When Luke opened up, he talked about less than 6% of the people who need help get it. We also know, according to the NIH, that the minimum dose of effective care for the average person is 90 days. Very few people of that 6% even get that. I'm a person in long-term recovery, barely graduated from high school. I teach at college. My story is unremarkable in the recovery community. We do great things. The other thing that we know is that when people like me, when I hit 5 years of recovery, my chance of staying in recovery for the rest of my life is about 85%. Yet we don't provide care. This is what we do for cancer. For cancer, you get cancer, they're going to follow you around. They're going to try different therapies, different approaches until they find what works, and they're going to stick with you until you get in 5 years remission. We need to do that with addiction. Because our central organizing question should be, how do we get more people to 5 years of recovery so that they stay there for the rest of their life and they heal their communities?
I'm going to put someone on the spot, Mark Bird. We're lucky to have Mark here. Mark's been the lead opioid litigator in the country. But more importantly, he comes at this because he lost one of his lights, Jesse, tomorrow, 12 years ago, to this disease. And so it's very personal, beyond the hundreds of thousands of families that he's personally assisted in this from a legal perspective. But Mark, maybe you could give us some insight.
First of all, I'm humbled just being around all of you. I'm just a trial lawyer, and, which I've done for 47 years. I've done all kinds of things, including representing 11,000 men and women down at Ground Zero after the towers fell. And I was also instrumental in getting Obama to sign the Zadroga bill, which helped and continues to help today those who are still dying from their exposures at the World Trade Centers, not too far from where we're sitting right now. My son was 31 years old. He was a hedge fund kid. And he had struggled with drugs, alcohol, all kinds of drugs. He loved selling LSD. He wound up in military school. And when he was graduating, number 2 from his class in military school, he actually showed Barbara Bush around the campus when he was high as a kite. And this is something that I wish that no other parent would ever have to go through. There is nothing like losing a child. I have other children, they're wonderful, but the memory of my son is with me every day, every minute. And to have this opportunity, because I moved out of New York 9 years ago, and I live in Aspen, Colorado, of all places. First place to Colorado, the first place to make all recreational drugs legal. Isn't that great? And I have a lot of friends that are involved in the industry, and they know that I'm very, very, very opposed to legalizing marijuana. In my opinion, contrary to that of many doctors, child psychologists, it is a gateway drug.
Absolutely.
Don't think that our kids start on cocaine, they start shooting up, whatever it is. And of course, one of the arguments is always alcohol. Well, you don't really think they even started on marijuana, it had to be alcohol. There's nothing wrong with alcohol. And as Kevin indicated, we lose more people every day, every year to alcohol. And then, of course, that just morphs into whether it's marijuana, cocaine, all of the other drugs. And so, I mean, I could just go on because, as I said, if I save one parent and one child from having to go through this, I will have had a successful life. And I want to do that. And to be surrounded by all of you is truly a privilege that I never thought I would have. I work hard, and actually I was in college when Mitch was started. I was born at least. It's an incredible organization. This is amazing. Patrick, Kevin, Luke, thank you. I will do whatever I can. I hope that I can help.
Open table.
Question. So it seems like some of the policies that you had up there could be or are in conflict with organizations such as Drug Policy Alliance. So I just wanted to address the elephant in the room right off. So that's my. So
True or false? I mean, look, we are an organization that is trying to push policies that lead people into recovery. And anybody that, if they share that with us 10% of the time, wonderful. But there may be groups like the ones you just mentioned that don't share that with us most of the time. And that, we think that we have to start with prevention. And that we have that our interventions for people that are using need to be aimed towards recovery. And so that means, when we talk about prevention, obviously evidence-based prevention and awareness, as opposed to what I heard at a conference recently, which is, hey, why don't we just, we should teach kids who have never used how to use drugs safely. And to me, that's antithetical to what prevention is. And so, and to me, we have a disaster with our currently legal drugs that kill more people than fentanyl ever did, because they are marketed, promoted, and pushed by an industry above board legal that is able to, hide behind, hedge fund managers and suits to essentially hijack the brain and get that brain as young as you can to have a lifelong customer, whatever that substance is. The other thing is we have hope. We think there are things that actually work that we can do. It's just a matter of will. It's not even always a matter of money. It's a matter of will. I remember the first ever drug court evaluation was in early 90s. And it looked at the Florida drug court and the Washington, D.C. drug court. And it said, this program, which changed behavior because of incentives, credible threats and good incentives to help change behavior. And it said this program proved that changing user behavior is easy, but changing bureaucrats' behavior is hard. Because a lot of people are used to doing things the same way in public administration. And so that's a nuanced, tough issue, like an example of a nuanced, complex issue that we are going to tackle and take up.
So are you anti-harm reduction?
You know, I think harm reduction, no.
I'm not gonna be one of all.
Because listen, harm reduction means a million different things to a million people. I think it's a term that gets people in a lot of trouble. You often agree on 95% of things, and then you bring up a term and you end up screaming at each other on the 5% that you disagree with. I see the first job of harm reduction should be to prevent initiation. You can reduce the most harm by preventing harm in the first place. Obviously, if we're talking about groups that are severely addicted and we have very little outreach, we have to think of innovative ways to get them involved, to get them to talk to folks, to get them to get help towards recovery. But I don't think harm reduction, that kind of harm reduction can be an end point. That to me is not the end point. The end point has to be the recovery. It's a beginning of engagement. It's where you meet them where you are, but as Patrick said, you don't leave them where they're at. And so, you know, that's, to me, that's what it is. I don't know if there's a better way.
No, you said it wonderfully.
And for me, it's not about your fears, it's about your tears. When you get tired of crying and praying for your loved ones and wanting them to get the help that they need, you have to be willing to do the work. You have to be willing to be the boots on the ground. Be the change that you want to see, and we are the change here today that we're going to make happen.
Lauren, Representative Davis.
Thank you. Well, to start with the question, am I allowed to respectfully disagree?
You can do whatever you want.
Great. Well, hi, everybody. I'm Lauren from Washington State. I just can't help myself, but counter a few of the things that were said. You know, there was a comment that most people in active addiction aren't interested in stopping, and we have pretty strong data from Washington State. That's not accurate. We actually do surveys every year at our syringe exchange, and 82% of individuals with a primary opioid use disorder are interested in stopping or reducing their use. I also heard it said that people in active addiction are comfortable with their use, and I think that's really dangerous and damaging and really inaccurate. Just a quick anecdote: a former ex-boyfriend of mine relapsed long time ago, heroin meth, and I was in some hotel room with him trying to make sure he didn't die. And I watched him stabbing himself for an hour and a half, trying to find the vein, and he ended up covered in blood, and he was shaking and he was crying and said, "I can't stop, I can't stop." That is active addiction. The whole essence of active addiction is using to escape the present, because the present is too painful a place to be. And, you know, I convened a focus group in my legislative district a couple months back related to starting a crisis center. We were working with folks who've been incarcerated with addiction. And there was a gentleman who spoke up and he said, "I used drugs for 20 years. And then he ended up arrested. And he said, if the drugs began to leave my body, my first somewhat sober thought was, this is me and I hate me. I can't stand myself." And this is very much a disease of self-loathing. We know that one of the diagnostic criteria for substance use disorder, to be diagnosed, one must have continued use despite negative consequences. So I would caution us to think about the criminal legal system as a first or even a second or even a third, because that's actually inaccurate. When you make people feel less than and other, you actually create barriers to recovery. For people who are already there, violent crimes, et cetera, absolutely, we need to provide treatment within the system. There's a quote, incredibly powerful quote by an outreach worker that says that who's doing street outreach. The obstacle to my client's engagement and treatment is not an absence of pain, it's an absence of hope. And I think we need to be in the business of hope. We care about science. There's a lot of hope science. There's an incredible body of literature around that. And the last thing I'll say is the importance of harm reduction. Nobody can recover from addiction. And as somebody who has sat with loved ones using and been unable to sit with loved ones who are using, but knew they were using, trying to FaceTime with a loved one using, so that they're telling me which bathroom stall that they're in, so that if they overdose, I can alert somebody. We need to think very creatively about how to engage people who are in the darkest place in their lives.
Thank you, Lauren. And I want to just echo that in terms of our vision. I love what you said about the fact that folks don't want to languish in addiction, that they can get free from it. That's, I think, what our paradigm and our vision is that everybody has that ability, has that agency to get free from their addiction, and everyone needs that opportunity. So we are not content to just say, well, there's going to be a few people left in society that we're just going to have to leave in their addiction. That is unacceptable to us as an organization. That is not a vision of the world that we espouse. We espouse a vision of the world where everyone has that opportunity. And I believe everyone innately has that ability to live a life free from drugs. And that is what we're fighting for. So I couldn't agree with you more on that.
And these kinds of discussions are what this is all about. And I don't think there's disagreement. I think there's agreement with it. But we want to have, we want to have these kinds of rigorous discussions. These are hard conversations. It's a complex issue that also we know varies by individual and individual's experience. And so I think what you said is very powerful and very needed. So thank you. Anyone else? Any other report? I mean, I have some questions for the group, but I'd like just commentary. Yes, Mr. Williams.
So I'm most interested.
Can you introduce yourself?
Sure, sorry, Billy Williams, I was U.S. Attorney in Oregon from 2015 to 2021. And when I tell people that, they're like, how did that happen? My siblings ask me that when they know we don't belong to a political party. So I was a prosecutor for 31 years in state and federal. And before that, I served as a trial assistant in the public defender's office for a while. I spent a lot of time in jail visitation rooms with clients. I'm most interested in what the strategy is to do something. Everything has been studied and studied and studied. And then you've got states like Oregon. I appreciate Oregon being on the slide for all the wrong reasons. But in 2020, Parliamentary 109 and 110 were passed. 109 pertains to psilocybin and care, and then 110 decriminalized all possession of all drugs. And let me tell you something, it's a mess. I felt safer downtown New York City this morning, wandering around than I feel in Portland, Oregon. And it's an open air drug market. And so you've got people. I sat with a reporter in March, second floor of a coffee shop, looked across the street in an empty business. 3 young individuals were shooting up in their ankles, and it was horrifying. They were bleeding, they would pass out. And it's like, this is what downtown Portland, the city I've lived in for 31 years, looks like. So well-intended people voted for those measures. In the belief that treatment is a better alternative to incarceration. I get that. I get that discussion, having not just prosecuted people involved in drug offenses for 31 years, but understanding what the dynamics are and what can lead people to that. Fast forward to Kevin's invitation to join. You've got people voting for things that they don't really understand, right? And what I don't understand is the lack of leadership in our government, in our federal government, to do something about it. Intelligent, informed. Kevin came out in 2019. I hosted a second summit on marijuana. I chaired the marijuana working group for the Attorney General's Advisory Committee. And we had one in 2018, right after the Sessions memo came out. I just invited everybody to the group. This is what excites me about this. People in the business, their lawyers, treatment. People were adamantly opposed to any marijuana legalization. Just whoever wanted to come. About 150 people pre-summit. And that helped me form my policy decisions about what cases I was going to prosecute in Oregon on the federal side of the house. But what struck me was I had people coming up to me after that first summit who were, including the person who wrote the original ballot to legalize recreational marijuana in Oregon, and said, "Thank you for inviting us. No one wants to hear from us." And my bringing that to the discussion today, how can you not solve problems without talking to all the stakeholders? What's going on right now is, it's just stupid. I'm sorry, I'm known for this saying what comes across my head sometimes, but it doesn't make any sense. You've got people in the cannabis business, just like the opioid business, who are making millions and millions of dollars exploiting other people. Why is that? Why do we have politicians taking money from drug companies and cannabis companies, and then pushing to legalize it federally? That just strikes me as odd. So what I really want to know is, what is the game plan with moving this forward, having those discussions, and getting something done? Because other states will follow the ignorance of Oregon with what they've done. And I'm telling you, I've lived in Oregon since 1983. It's a mess. It's an absolute mess, and just really sad, because I see people suffering, and we need to do something that addresses what the real harm is, and have a plan and put pressure on people to stop voting their pocketbooks and voting their conscience on what needs to be done. And I'll stop there.
No, it's true. I mean, and in Oregon, now the evaluations are coming through with that vote, and we know that less than 0.5% of people in Oregon in that new program of criminalization are actually referred to treatment.
Yeah.
So even if, if you were wanting treatment, which is laudable, over incarceration, and you voted for that thinking that's what you'll get because that's what they were sold, we're actually seeing the outcomes have nothing to do with that. It is a complete hands-off approach. It's not humane, because it's not even getting those people the help that they need, that we apparently promised them through that measure. And so we know we're going to see repeats of that in various states, and we're not going to have the $15 million in a state like Oregon that you would have needed to defeat it, or in a state like California, you probably need $50 million to go up against the machine of groups that do want this to pass. So we're literally looking at this. This is a long game. As much as we have a sense of urgency and fire under our feet in the first 2 years, we want to get a plan together and push it in Congress and go to state legislatures. That's what we would like to do, to answer your question like in a short way. But we are looking at the long game here, because sometimes things have to get a lot worse before they get better. Sometimes we have to burn our hand on the stove to realize that the stove is on, and to be convinced that the stove is on. And it's unfortunate, because people will die in the process, and families will be torn apart in the process. We'd like to prevent that. But one thing is, we have several people from organizations, and I thank them for coming, like Shatterproof, Kevin Roy, who's here doing incredible work on the treatment side. We have the Partnership to End Addiction, Creighton Drury, Fred, and Dr. Richter here. All friends of ours. We'd like to really come together as a field on all of these issues, on all these policy issues, and work together to try and educate people, as difficult as that might be, but educate them to make the right decisions here. That's our hope.
One more thing, what people don't realize, those making the most profit off of all this are drug cartels. Nationally, but that's particularly true in Oregon. And so what does that mean for, supporting law enforcement? And I don't know how many of you read Sam Quinones' Smooth Dreamland. I actually had the pleasure of talking to Sam a few years ago at a Ninth Circuit conference, and I asked him the question, well, what do you think is going to happen now that, recreational marijuana is being legalized around the country? And he said, that's a really good question. But drug cartels are laughing at all of us, and they won't be coming to the table.
Well, actually, speaking of the international role of cartels, and Brian, I hope it's okay if I put you on the spot a little bit. We have a guest from the International Narcotics and Law Enforcement, the U.S. Department of State, Brian Morales, who I've worked with for many years now. I mean, Brian, maybe you can paint a little picture internationally about the need for leadership and kind of the pressures, and that the U.S. and our global partners are feeling, just given the current crisis.
Sure. Thank you so much, Kevin. Thanks for the invitation. I cover two sections. I cover drug supply reduction, trying to stop the fentanyl and other synthetic drugs from coming to the U.S. Borders. And that's typically where we think of our international role. But today I'd like to really say that addressing addiction internationally is just as important as it is addressing it domestically. That's the other half of what I do is substance use prevention, treatment, recovery in about 110 countries around the world where we have partnerships. And this is a particular challenge because there's so much production of coca, of opium poppy. Cartels are looking for new markets. They're expanding their consumer base into the global south, into Latin America, into Africa, into Asia, where the UN and the World Health Organization projects that there might be a few percentage point increases or decreases in different regions of the world over the next decade. The continent of Africa is expected to see a projected growth of consumption by 40%, which is going to devastate countries throughout the continent, simply just by the sheer volume of the consumer and what that represents for economic development. We're interested in addressing addiction internationally because it is not just a public health issue, it is an issue of stability, it's an issue of national security for many of our partners around the world. Transnational organized crime is fuel, and just addressing addiction in one country, even if in the US, is not going to end the problem. We've got countries all over the world that are kind of growing and growing their treatment system. Formal treatment system is growing, and the informal system is even growing larger than that because it's just so much treatment demand that can't be met. So if I leave with you all with one message today and the foundation congratulating your work, but look at the international aspect as well, because it really is, US produces over 70% of the world's research, and we really need to help other countries translate that and get that out into the field.
Absolutely. I mean, we know that we're not going to shirk that role of global cooperation. I think it's really important. And even as a domestic US organization, I think that's going to have to be a key priority for us. So thank you, Brian. Thank you for your leadership.
I just want to challenge us to look at that recovery is really the umbrella and that treatment is a piece of that, but it's not the whole thing. And too many times we look at treatment as the whole thing. That is not from beginning to end. That could be. It doesn't have to be. Treatment doesn't have to. And we have to do a better job at letting people know what their options are, that you can go into recovery without treatment. That is possible. You know, you can go to recovery community organizations, you can, there's medication assisted treatment, medication assisted recovery. There's lots of different options. And I'll tell you, in talking to organizations, we're siloed up. And I say, if I go to a methadone, guess what you think the number one thing they're going to recommend for me? If I go to a treatment facility, a residential, the recommendation is probably going to be, if I go to an RCO, the recommendation, so you can go to any silo, prevention and intervention, any of those silos, it seems that they protect themselves versus, and they don't serve the person. They want this, it's like the system says the person has to serve them. And I really want to challenge us in looking at that, because until we look at those systemic issues, we're not going to get this better in dealing with it. And I do want to say, I commend you for talking about alcohol. Thank you, thank you, thank you. That is, one of the things that we've been talking about, and we've talked in California, and it's been a long time, but it's probably been 30 plus years where we tried to get a nickel a drink, as far as taxing, and we get the tobacco companies, but a nickel a drink, seeing because the lobby is so large. And so we recently, in the last 5 years, we've been trying our own proposition called human redemption value and HRV. And we looked at it, it's very similar to the, bottles and everything else they have CRV in California redemption value. Well, what if we taxed all the bottles with serving alcohol and wine and everything else and had this HRV, and it was a symbol of, recycle is a triangle, it goes round. This is triangles going up and out, moving people up and making people better. And And so we looked at that model. Of course, we kind of have had resistance, as you must believe, but I really commend you for looking at alcohol because it's in our society everywhere. And I'm not anti-alcohol. I just think that they need to pay their fair share to be able to help people get better.
Thank you. In this process, I wrote down a couple of questions that would be helpful to us as we move along, and there are several more people who I'd really love to hear from. I mean, the first question is really, what are some important key messages that we should be emphasizing with lawmakers and the public? And I think we touched on some of them here, but I don't know. I mean, we touched on a lot of them actually. But I don't know if anybody had anything else to add to that question, or if yes, please introduce yourself.
Brad, sort of compared to, one of the things and I realize that it may be a controversial topic in this, with this particular population, but I think it's a conversation that we're not having is, I think, look at something like type 1 diabetes, the way they talk about the illness is that they have not yet found a cure for it. Yeah. It's been like totally anathema to our field, talk about the possibility of, whether or not it's a, one-shot therapeutic, that a vaccination for addiction or something to that effect because of, whatever historical beliefs. But I feel like, as we're talking about this, we're in this conversation, we've got supply side maneuvering, which hasn't worked for 50 years because it's an irrational consumer, it's an irrational marketplace. You drive up the price, people just subordinate their needs. People who weren't going to sell drugs are willing to do it because they can make money. Or harm reduction, allowing people to use and kind of mitigate the risk. And it just to me seems like, okay, so we're 10 years in the future. I mean, are we in a more sophisticated dynamic of these things, or are we really kind of be driving towards, a solution where we can start heading this off legitimately through medical intervention? Because I just feel like if we don't figure that out and that doesn't become the focus, there isn't really a great deal of optimism that the thing that we're experiencing right now is going to improve.
Yeah, I know NIH has put a considerable amount of money in things like vaccines for addiction. I don't know. I mean, I think we're far off. You can't even get a vaccine for other things people want to take, but I mean, for this, I think it's going to be interesting to see where that goes. I don't know. I mean, I agree that medical and science technology, and we know so much more about addiction now than we did. What we've learned in the last 20 years is more than we've ever learned. And so if it continues at that trajectory, I think there could be something there. I do think that we have to look at science. I'm a little bit personally skeptical of something like a vaccine in our lifetime, but it's possible. It's possible. I'm glad you brought it up.
Yeah, I mean, again, all I'm asking for this group is historically, immediately that door closes in the conversation. Again, maybe it's not in our lifetime, but I do feel we have a responsibility to 1 million people that have died in the past 20 years, to not throw anything out as a possibility. Again, polio, there was light on society for one day it wasn't, because we figured out a solution. And I feel like that needs to be our North Star.
It's coming back. I heard, but no, you're right. That's a good analogy. Oh, if you can introduce yourself.
Okay, Melody Heaps. I was a founder and president of an organization called Treatment Alternatives for Safe Communities, Street Crimes back then. And it was the first criminal justice treatment intervention program that then and now in Illinois has been expanded to everything from arrest all the way through incarceration and pre-release. I'm also have the fortune to work with Mr. Morales and helping him on that issue and a few others with regard to developing his, what he calls ecosystem, and I call global infrastructure on demand reduction, which is amazing. I know it's almost silly to say this, but Mr. Williams, you cued it to me when you said, how is it that such intelligent people who ought to know better were able to vote to? It's like, because they don't believe it's a disease. Nobody believes it's a disease. Sometimes our treatment agencies don't believe it's a disease. We have never, ever accepted the fact that substance use disorder is a medical, biological, psychological problem. And until we can clarify that and educate people about it, until we can get to that point, we're going to constantly be playing around with this. The only other question I would have, and I think it was kind of implied that I would think this group has to be very careful and has to balance. What we don't need to be is that group that is fighting legalization. That's not what we're about. We're about helping people understand that substance use disorders are a disease, that it is an epidemic in this country and around the world, that it needs to be addressed by the science and by what we know about the medical community and the research. And that focus and that education has never really taken place. It's taken place, we talk to each other, but we don't talk. We never talk. We don't use the social media. We don't use clever media pieces. So I think the concept of really talking about and believing we're dealing with an epidemic, which is a disease, which is global, really will help. And to as much as possible, not get caught in that fight. Is
One of the pushback that we've gotten, Melody, on the disease
Yes, tell me,
we
right.
talk about actually comes from a lot of the quarters that are pushing,
Yes.
I would say, very extreme on reduction
Yes.
or legalization.
Yes, I
Saying, wait a minute, don't call this a disease. It's a lifestyle that I've chosen. And in my mind, they've changed the face of what the original harm reduction, of course, was something that was for mainly with people with HIV, AIDS. It was, about needles before there was any therapeutics for AIDS. And it was a very specific intervention designed for people at the very end of the spectrum that were like that. Now I see a lot of advocates taking that term and turning it into, actually, it means I can do whatever I want, whenever I want. And in fact, not only meet me where I'm at, but give me what I want. Forget about don't leave me there. It's give me what I want. And it's whatever I want, and it's my choice. And we see a lot of those folks, which is ironic because the pushback against disease used to come more from law enforcement, criminal justice, which would say, wait, no, this is a moral failing, this is a crime, it's not a disease. Now, I don't hear law enforcement pushing back against disease at all.
Right.
They're saying it is a disease, and they're saying, please help us,
right.
because we are not equipped to deal with this.
Right.
But the pushback against the disease model is coming from fashionable circles now, who are saying that do not call what I do, my occasional heroin use, a disease. I'm a successful person, and it is my lifestyle choice, and stop talking to me. What do we do with that?
But we do know that one could have said that about tobacco. And
Sure.
we do know that the more we have worked on what tobacco does to the lungs, and it has really reduced the effect. I'm not sure how you get there, but I do think that engaging a science community that can articulate very well, can go on CNN, can be on social media, that begins to talk about the epidemic of substance abuse, what it does to the brain, how it, for young people, more and more of that message. Don't engage the other side. Just say, hey, we're just telling you what the latest research says. That there is a way to be clever about structuring that messaging. That's all I'm saying. And to be very cognizant of that trap, which is what they will try and do. People will try and get you into the trap of, oh my God, it's not a moral choice. It's just the fact that we know drugs alter the chemistry of the brain, and it has the following effects, and here it is. So how you get that organized, how we organize a science and the messaging, I think is a very critical component.
You brought up social media, and I wanted to talk a minute about that and actually get others, especially from the partnership, to maybe comment on that. Many of you know, we all remember the fried egg commercial. Everybody alive, I think, remembers that commercial. And that really, derives from the great work from the partnership. But that was a long time ago, and now we're aging everybody here. That was, when I was a kid, that was 30 years ago. At a time when media was 3 networks, it kind of became 4, but that was basically it. Now we look at media and the dynamic, we look at social media, we look at where kids get information. The idea that we had a more robust awareness campaign at a time when we had 3 networks and primitive technology. Now we have social media, which, by the way, is helping to facilitate a lot of drug trafficking and drug use, number 1. But number 2, not only are they, so yes, they're doing some bad in that way, but they're, at the very least, I would think that they could do some good in helping push proper messaging. And yet it's kind of been, radio silent. Yes, I get that a lot of the social media companies have, they'll light up purple for Recovery Month and take a photo with some of the activists, maybe some of you around the room, and they'll say recovery is great for like an hour. But there's not a lot of money behind it. Maybe they'll sponsor a conference so that we shut up for 50 grand, but that's it. There's not this focused effort on reaching kids where they're at, and they're on social media. to talk about the awareness. So I don't know, Creighton or Fred or Linda, if you want, from the partnership, if you, I'm sure you've given this a little bit of thought or comment on this, but to me, the idea that we were more advanced as a national, we had national messages that everyone heard in 1986. And now we don't have that anymore. In an age where we have so much more ability to do something, it confounds me. And I don't know if there's anything to say about that, but.
Do you want to take that one? Yeah.
Right.
I have a couple things. One is, one is, yes, with the advocacy of the ads, they were always great. So we just have to be mindful of a single message. And knowing the nuance that is needed for primary and tertiary, secondary and tertiary prevention, those messages are incredibly different. So, in terms of the campaigns, they're much more complex than they were. And so just blanketing is not what we need. And so, what we tried to do, and we're trying, particularly with SEO, but also looking at how people are searching, is to really personalize and target in a way. So depending on where you are on that journey, it's very hard to do that and you buy in from the social media. So, with Google, we have some keyword, searches that will drive people to our helpline, for example, if they're struggling, versus not somewhere else if they're in prevention. But, I echo the frustration that, and Mitch, you should be answering this question too, I echo the frustration that there's not a unified media plan. And, the last sort of big one, I would say, where it was really driven by, was above the influence, which was, where it was a comprehensive federal government prevention that worked. It actually worked. And then you have Truth, and you have all these other, and if you look at Truth is a great example. Also, they're doing text messaging now. They're targeting different groups. They're targeting. So I echo your frustration that we need it, and I think it is one of the most important things we can do as a group is to bring other stakeholders together for a campaign. The problem is we have to agree on it. So that tailoring is maybe one way to go about it.
It's true.
Well, but Ben Tucker, this is interesting conversation. I ran when I was at ONZCP, one of my responsibilities was the ad campaign, above the influence. And it was tremendous. I used to go to conferences. I traveled a lot around the country, and I'd be in rooms with 10,000 kids. And these kids were there and engaged in, the advertising firm was extraordinary. They had been doing it when I arrived there 10 years. And the people on that account they had become part of the message themselves. They were invested in doing that campaign because they believed and they saw, and the data suggested that kids would listen. And to your point, you mentioned lawmakers, Kevin. Here's our challenge we have with social media, but also mainstream media, which is, in my view, I've been in the business, the drug prevention business, since I joined the police department in 1969 as an 18-year-old. They trained us to be drug prevention specialists with Dr. Benny Prim, who was running the treatment, early treatment in Brooklyn, where I grew up in Bed-Stuy. They sent us as young people into the schools to speak to young kids about how to stay away from drugs. So looking at it then, but also that was at a time when heroin was king in the city, and no one was talking about treatment for those folks, and these were primarily Black people who were strung out, and alcohol was a big part of that as well. So you had what we call winos in those days, but these were people, lost souls, no less lost than the folks using drugs and shooting heroin. But they were drinking this fuck, as they called it, and it was killing. And no one, we treated it as a criminal act, right? And no one cared about that. And so, I had to sort of educate the mayor in the prior administration about this issue because he didn't get it. And he didn't think that. I said, no, you don't understand. You have to add race to this discussion, and maybe it's small r race, not capital R race, but to me, it's just as insidious because it exists. And so you get those challenges.
But the media I've also experienced over the years is also lacks integrity. Then has less integrity in my view than it used to have. I'm talking about print media, I'm talking about television, and certainly social media has grown into that, and so there's this competition. So that's another hurdle that we have to overcome. And then the final point I'll make, and really you talked about this, you said, who are these people? Well, these people are people who have their own perspective when you talk about laws that are passed and that sort of thing. Our legislators, and I do think we can educate people as much as we can, and we should do that. And but the other piece to this is we're working in living in a culture where we also have to look at and why this meeting is so important is because in my mind, this is, if we have a chance of, and we have to assume, just while sitting here, that we believe we have a chance, we have to assume that we can make a difference in some way or another as we move forward. But you think about the other systemic challenges that we live with. We live with poor education in many of our urban centers and then some. We have mental illness. What you're seeing on the news these days and have been now for many, many months is people who are mentally ill, who are acting out in violent ways. And they're doing that because we've abandoned them, basically. We have no structures in place to really give those people what they need. So you add that to the table. So that's a systemic challenge. You add the housing, the poor housing piece, where in New York, the public housing system used to be really actually pretty functional and was maintained properly, and now it's deteriorated to the point where it just has been eviscerated and people are living in squalor and can't get the assistance they need to fix their no electricity, no water, all of those things. But I tell you that because when you start to add it up, and this doesn't seem to be any willpower on the part of our legislators, our governing bodies, or the executive branches in many instances, although they have some skin in the game because they have to deal with the complaints and crime and the violence. And so those are the things. But so as I think about this, this challenge, and I've been thinking about it a long time. I did research. There was research on reentry in the early days, in the early 90s, and also, pre-adolescents who have to get involved in drugs and crime. So we've been here before for far too long. We're still here. And so it is the right question is what do we really how do we really approach this? And I think we approach it like, you eat a little bit at a time. But we're strategic in the way that we approach it. And then on the supply side stuff, I mean, Bridget can speak to this better than I could, but and you're right. The cartels love it. They are loving it. They loved it with legalization, and that put us in a really bad spot. Kevin, they were growing up in the Sierra Madres, destroying the natural habitat and growing weed rather than and so the black market hasn't disappeared, and some of those growers are indeed overgrown and so there's a lot, I think, that goes into that we have to consider, and then we can choose about how we approach, what's the strategy and what does that look like? But knowing that there's a reality out there, and the final thing I'll say is that hospitals are, I think, critical. I became a trustee at Northwell Health earlier this year, and I will say that I've gotten an education, and the fact that they wanted someone like me on their board, made sense to me when they started speaking about the gun violence, that they see the trauma in their ERs, we see it on the streets, and the same thing with mental illness, and the doctors that I spoke with about it have not yet stopped talking about the insurance companies and the fact that they don't cover, the treatment and so forth. So sorry to rant.
No, it's all there.
Kevin,
another sort of basic point, I'm building on Penny's saying that we were talking about quite specific drug policy solutions, but it's not losing sight of the fact that other seemingly policy solutions are part of good policy.
Yes.
We started talking about systemic, good education policy, good food policy, good family stability policy, good healthcare policy. We're talking about addiction as a disease, and never mind getting to the issue Fred touched on, how do you find the right messaging? I think part of it is in a simple way, how do we get people thinking about these issues in more normal ways, if that's the right word? Like, this is a systemic issue that, oh, this is part of, we talked Linda, Dr. Linda, Kevin, you didn't call me or Fred, sorry. We talk all about it, right? But when you start thinking about issues like prevention, right, and understanding that we have a lot of different facets to that. And so in some ways it makes it more complicated, but I think it's important we don't lose sight of the context as well, because I think that becomes very important when we're thinking about. It's one thing to come up with a lot of good ideas, but I think we're going to quickly get into the space of how do we move forward, how do we agree on what's actionable, right? And sometimes there's some low-lying fruit in the context of, let's point out other policies that might be having, taking hold that are going to have a positive effect now or down the road, or not,
Right.
without complexity.
Dr. Goodwin, I think you had your hand up as well, sorry.
I did, thank you. I'm gonna bring it back to an earlier comment about social media and public health. I'm a researcher, I'm a psychiatric and substance use epidemiologist, and I study, I've been focusing on for the past 5 years, so is the impact of, I used to call it legalization.
Would you speak up?
Yeah.
Oh, sure. So I'm a researcher studying this. So I was just saying, over the past 5 years, have been focused more on, I used to call legalization. Now I'm calling it commercialization. And what effect that will have on children and use. And so one of the things I was going to mention in terms of social media and I think public health campaigns is that before I started thinking about this, I focused mainly on tobacco use. And in tobacco use and alcohol, when I start a paper or a grant, I say tobacco use is very bad. It's the leading cause of preventable death. It's this and that. Same with alcohol. I can't, now it has become a context where we have to be very careful. And it seems political. Well, there's two issues. There's a political issue, and I say to my colleagues, like, be careful because whoever's reading this is probably enjoying, let's just say cannabis, because that's what we're focusing on. And that's fine. That's whatever people want to do. But I can't say I have like a 5 or 10 references where I can say, and this is what happens when young people use it, because there's so little science, and this is what we're trying to do. And I submitted a grant in 2002 or so to study the long-term impact of cannabis use on cognition with an amazing data set. And they're like, yeah, no, thank you. We don't care about that. But we are trying, so there's very little known. I mean, we have these little snippets. So, but to the point here, that's my problem. That's what I'm going to try to do. And objectively, we don't know really. But in terms of PSAs or how to address prevention, with tobacco and truth, they say, these are all the things that are going to happen. Somewhat our hands are tied with some of these other things because there are no PSAs. There are no pediatricians are not educated about what to tell either kids or adolescents or parents. Physicians don't know. If you go to a physician, they say like, well, I'm using a couple times, like I like marijuana, it helps me feel calm. They aren't getting information about what to tell their patients. And so we're a little stuck there. And then part of my thinking on that is that even though I've been focused on recreational, is that, I mean, this is a little in the weeds, so sorry, but I think the, I know it's unintended, but like, no, we say it all the time, is that the government telling all these young, this is what I sit there working on this paper today, and I'm like, I can't finish the last 5 paragraphs, and I have no problem writing, but because I feel like I've said it, I've concluded these things 5 times before, but that the government telling kids and telling adults this is legal has led to such a dramatic decline in the perception of risk that we wrote a paper on it like 4 years ago, and that we have a little bit of a new twist because, anyway, hopefully you'll see it soon, which is even more even scarier about how the system works. But someone recently brought my attention, because I was like, who cares about medicinal, like that legalization doesn't matter. But actually conveying to people, nobody says that cocaine is medicinal. And so, there's this perception that it's good. So that is even a more complex message to combat. I get tweets that say, go try this, it's good for you. But so we need, sign of this isn't science. So I'm trying to answer those questions.
And you're personally going up, I know this, against the industry where you live. That's kind of, I don't know if you want to talk about that.
Well,
that's all.
I can say, two things on that. Well, I'll say about that, but also just lastly we were talking about the vaccines before, but I had a different thought about that recently because we did publish a paper on depression today that I personally, someone asked me to write an op-ed, but I would tie to potentially some of this because it's so high among youth. Depression is like 20% among youth in 2020. And reporters asked me, well, is this a crisis? Like what kind of crisis? Well, we all know about the flu and getting the flu vaccine, right? And this is something all kids and parents know about. And I looked it up, and that flu is terrible and it can be deadly. But the estimates suggest that if 40 to 200 children die each year, which is tragic, of the flu, and suicide, which this was related to depression, but I'm sure you'll have the number for this, suicide was 5,000. So we all know about the flu, but where are the public health announcements that say, if you're struggling with this, if you're struggling with depression, and both, which is usually the case. Yes, in my neighborhood and New York, I am observing what can only maybe no one else here lives here, but I've been working with Suffolk County, or I've been testifying about a bill that would draft stricter legislation in Suffolk, which is in Long Island, than the New York State regulations to ban packaging that appeals to children and advertising that appeals to children. Most people can not argue with that,
So you're still having to work on it and testify it and go uphill.
Yeah, it's deadlocked because Suffolk is worried that New York State is going to preempt them. And so we're analyzing the legislation. But meanwhile, New York State regulations are stuck. Nothing is happening, and we don't so yes, I did get I know of at least 3 tobacco shops openly selling cannabis. I went in there the other day, finally, the last time I went in, someone is installing something, says, I don't even believe for a second that you're in here to buy it. You're probably a professor doing a study. I went in another time.
Well, thank you.
Yes, but then someone believed me, and they are just it's very, this one is across the street from the school. Right across the street. I've identified at least 3 or 4, and I did right before coming here, get an email from Eyewitness News asking if I will identify the locations, and I'll go on camera as a scientist, but is anyone willing to go on camera and say more? Which I can't say, so maybe you want to, but yeah, it's a tricky bit for me.
Well, thank you. As we wrap up, I guess the last question, and it's really open, I'd like to kind of open it to the group, or if you have other thoughts as well, but you're all welcome to the dinner afterwards. What is one thing we can do at the foundation to achieve our mutual goals? We're taking notes, we're recording this, but we'd love to hear from you, from what you've heard today. What can we do? What is one thing we can do in your mind to achieve our goals, please?
Hi, I'm Ernie Beck. I work with Mitch at the Rosenthal Center on communications. And I think one thing that comes out of this whole discussion is we're missing kind of the fundamental, essential declaration that the addiction crisis and overdose crisis is a national public health
Yes.
emergency.
Right.
I mean, we've had the COVID public health emergency. We had recently the monkeypox emergency. 2 days ago, Governor Hochul of New York declared a polio emergency. And yet, you know, we have 108,000 people dead and one person every 4 hours in New York City dies of an overdose. And yet nobody stands up and says, this is a national public health crisis. And I think maybe the first and essential thing to do is for the foundation is to mobilize whatever resources are needed for President Biden or somebody to stand up and say this. You know, you could say, oh, that's just words, but it would increase public awareness, it would mobilize resources, and it would motivate people to understand that this is something that we are completely ignoring. And I think that's really a fundamental
very well said.
message.
That's very well said. And
I'm sorry Patrick isn't here because he showed me a wonderful photograph taken yesterday, or the day before, with his kids and the president.
Yes.
So there might be a route here.
If I may, on a suggestion, I served in the U.S. House of Representatives for 20 years, representing St. Louis, Missouri. And my suggestion to the foundation is to recruit heroes and champions at the local, state, and federal level. And I just heard Mr. Tucker suggest that the politicians have walked away from this issue. Short story, I met my wife to be 10 years ago.
By the way, he's here because of me.
But we go out on our first date and she starts drilling me about, am I a member of the addiction caucus? She knew my background. She knew I came from a community that had quite a few addiction issues. And I kind of laughed it off and said, no. And she said, well, if you're not a member, this will be our last date.
Just being a member of the ATR caucus, which was a brand new caucus at the time, it was acknowledging that the place that you represent has a severe problem in the community. And I can't date someone who doesn't take it as seriously. Not only did he learn, and by the way, we assume that they know these things because they're representatives, they're in Washington, DC. They don't know, and you don't know what you don't know. And not only did I make him learn about our field if he wanted to continue to date me. So I used that.
You made me into a champion.
Yeah, I made him into a champion.
Yeah, but I think a woman's caucus is very definitely right now. You get to have it, I like.
But I heard the professor say there's no PSAs on this issue. Well, one thing elected officials love is a camera.
Yeah.
And that is one lure, one way to attract people on this. I don't know, Representative Davis may have had different experiences. But it would be worth the effort to recruit heroes and champions from the elected body.
Yeah, and on both of those fronts, it's amazing. We were kind of looking back at some history, and in 1987, I believe you were there, 1988. No, this was the White House Conference on Drug Free America, it was called. It's sort of an old school name, but that was the name of it. But what that was every single CEO of the Fortune 100 company was there. Every single politician, they were vying, they were desperate to get in. Members of Congress, they couldn't accommodate every member, but the top ones were there. The who's who of business and government were there. When at a time when the problem in this country was a fraction, it is an order of magnitude bigger now than what it was 30 years ago. But that kind of national leadership was important. And you had businesses, which we haven't talked about, the role of the workplace, which is a huge, in employers. I mean, in so many levels, it's such an important role. But it's just ironic that at the time when this issue should be the top issue because of the death toll and what's happening, it is the lowest tier. When you ask a member of Congress or a politician, what are the issues that you're thinking about? And again, one of the things we want to do, based on exactly what you both were saying, is push our leaders to take this more seriously so that people are begging to come to another White House conference with Drug Free America.
Kevin, I think we, this organization, needs a public relations department. Yes, that works with the heroes and that is thinking about messaging all the time. Because it's gotta be packaged and put out by people who are professional.
And that's when I asked.
Were you creating a committee?
But we are, in reality, I'm not asking you to do that, but I am kind of, because we are gonna be, fundraising is gonna be important. We're not taking corporate money. We're not obviously, so there's limited sources, but that will be important. And we think we can be lean and mean like Sam. We've been grown with a very small budget. We've been able to do what we're doing on marijuana as a single group focused on marijuana in the country. With the foundation, we hope to do a lot with a little. And so that's also why I'm not necessarily saying open your checkbooks now, but people and and sources, this is going to be very important for us to do our work, to do the kinds of things that you're talking about. Please, final comments, Dr. Oh, yes. Yes.
I'm Aaron Arnold. I'm with the National Association of Drug Court Professionals. I've been trying to stay silent because too often the justice system is kind of the center of the conversation, and it doesn't need to be, but it is an important part of the conversation. And so one thing I wanted to raise is that in some ways, and many of you around the table will already know this, we are very lucky in the justice system field that we have 30 years of research on what strategies are effective in dealing with people with substance use disorders who are justice involved. There's been more research on drug courts and related kind of interventions than in any other justice system intervention in history. But what's really, really striking is how few people who work in the justice system have any familiarity or ability to implement the things that we already know work. And so I'm a former prosecutor, and one of the things I'm not shy about sharing is when I was a newish prosecutor in Phoenix, Arizona, I was ordered to go staff the drug court. And I was given zero training, and in fact was sent there with a message that this was a garbage program. You should advocate for every single person who tests positive for using drugs to go to jail and be revoked from the program. We don't support this in the trash. And it wasn't until much later, after I had already left and got into the justice reform field, where it started to dawn on me. And for the last 15, 16 years, I've been working in different organizations, training judges, putting on conferences, going out to courts, trying to build programs, and we've only scratched the surface. The number of judges who get zero training, prosecutors, defense counsel, zero training. And the fact that somebody mentioned over here on this side of the table, an outrageous number of people in prisons and even in the justice system generally have a substance use disorder. And the fact that the people who are making decisions about their lives have no familiarity with the disease model of addiction, have no familiarity with the body of research about what works in terms of how to respond to the cases, is, I think, a real failure. So in terms of what the foundation can do, try to work with, we have everything from law schools to judicial training bodies to medical training bodies to get kind of the stuff that we do know, get it out into the world so that people can implement it.
Useful. Thank you, Bill.
Yeah, so we know that substance use disorders are an incredibly complex condition. There's genetic, environmental, trauma, all of these things in there. And one of the things that could be done is to put together an understanding or help the public understand that there are people who can use substances without consequences. There are people who have, I hate mild and moderate. If you would have come to me when I got into help and said, do you have a mild, moderate, or severe substance use disorder? I would have said, oh, I'm mild. We have to understand that people we call now severe, we used to call addiction, it can't moderate. And so part of the muddying of the waters that we see is if somebody who has a milder form and can moderate their use. This is a different thing than someone who is addicted. We have to develop an understanding of that. And by the way, young people, the makers and sellers of drugs everywhere know the best way to ensure a market for life is to addict a young person. They know that well. So we got to make sure that that is. But on the other side of that, wellness, you know, we fight over the term recovery. There is wellness that is not recovery for people who can moderate their use. And really, if we frame out the continuum of substance use from no problem to addiction, and also wellness from people who can moderate to people like me who, if we don't get into recovery, we die. I've lost 2 family members to it. We will do a great service to society.
Thank you. Yes, so we're gonna, Julie, so you have, let's do the last 2, Julie and Pete, a minute each. Please.
Julie Killian, mother.
Can't hear you.
Julie Killian, I'm a mother, former elected official, and worked on this marijuana issue since 2009. Just quickly, when we passed the Raise the Age law in New York and created some drug courts, we didn't fund them. So that's like a whole nother, obviously, issue that we're not getting into, but like, oh, we have them, great, no funding for them. And I'll just say, I have a lot of thoughts, which we'll get into later. We should create committees. But I think the communication thing is a really big deal. I worked a lot on you guys on trying to not have legalization in New York and educating elected officials. I spent a lot of time doing that, at least the ones that will listen to me, which sadly are usually on one side of the aisle. But it's amazing. They don't want to find solutions, most of them. It's the easy things, and they're not willing to sort of peel back the onion. So to me, the only way to get to them is to really, I think the whole message about the youth mental health crisis. I mean, I think we've seen it a little bit, like some of the things that have come out about the relationship between cannabis and violence are starting to get more people to think, and just the whole aftermath of COVID and the kids being isolated and the mental health and people. I just feel like people are starting, parents, I'll just say people out there in the world, parents are starting to wake up to that. And I think if I had to pick for one issue or thing to get out there about a public service announcement, it would be that. And I have more ideas on social media and using influencers and whatnot, but I won't go into that now. We'll have to talk another day.
Pete, did you have anything to
Yeah,
say?
I'm not known for brevity, but I will, yeah.
Ask me about my opinion on something.
But, yeah, we'll talk about a couple of things, how we get things done, I think, you know. But here's the thing, I think we need to, I would love to see that we look at this from a diverse framework. You know, I look at the room and I want to make sure that we have more diversity when it comes into making decisions on this, and, you know, ethnicity, race, gender, all of that. But we also need to make sure that the people that this affects, any policy that we advocate for, that we get their involvement as well. Because I look around and I see who's here, but then I also look in the room and I find, you know, that who's not here, and you know, you know, maybe some of them are in Zoom land, but I think that that's going to be very important, because we've had a history to have, you know, organizations that push agendas that other people can't, you know, that they kind of pushes over or you know, misses people and their voice. And I just want to make sure that we have more voices that are heard, so that we can make intelligent design.
Yeah.
So I know that's hard for federal government and even government in general for intelligent design, but I think it's important when we go forward and we move with policies and looking with all the stakeholders.
It's a great comment, and actually it's a great concluding comment, because we need to do better for sure. I've been doing this for about 27 years now. I've done a lot of these roundtables though, and I actually haven't seen, I've been getting the comments have been coming in, a more open and honest discussion of different viewpoints around the table. And that maybe that's a really low bar that we had before, but I think it is a start. So I'm very grateful to all of you for all of your perspectives. We are building the plane as we fly it. We do not have the answers. We need to work with you. We want to be partners with you. I hope we started something that we can eventually be proud of, but we do have a lot of work to do. And we're only going to do it if we work together. So I really want to thank all of you, and I want to thank Mitch Rosenthal for hosting us at the University Club.
My pleasure.